If I told you that there was a product sitting, right in your bathroom cabinet right now, that could actually actively strip away your body's cellular defense system in like exactly 30 minutes.
You'd probably throw it straight in the trash.
Oh, absolutely. But the crazy thing is, millions of people apply this exact stuff to, well, the most sensitive tissue on their body every single day. So welcome to today's deep dive.
Yeah, we are getting into a really fascinating, highly specific topic today. It's an anxiety that a lot of people actually have, and it kind of stems from how we think about things like lip balm.
Right, the classic lip balm theory. I mean, you know the one, if you apply lip balm like 20 times a day, your lips supposedly just get lazy.
Exactly. They forget how to make their own moisture.
Yeah, and then suddenly you're biologically dependent on this like tiny tube of synthetic wax just to keep your mouth from cracking. It's a real fear.
It really is. And today, we are taking that exact anxiety, that framework, and applying it to a much more intimate ecosystem. We're looking at a specific question for you today.
Which is basically, if a patient develops a habit of continuous, daily lubricant application, do they develop a psychological or physical dependency? Like, can using lube every day actually alter or ruin the body's natural mucosal self-regulation?
Right. It forces us to examine this wild intersection of, microscopic biological machinery and these really deep-seated psychological boundaries.
So to get to the bottom of this for you, we are synthesizing a massive stack of medical literature. I mean, we've got World Health Organization guidelines, clinical trials on the vaginal microbiome.
Which are incredible, by the way.
Oh, yeah. Totally mind-blowing. Plus, we're pulling from gynecological studies on vaginal atrophy and some truly eye-opening psychological research on this concept called sexual safety behaviors.
So as a roadmap for this deep dive, we are going to unpack exactly how the female body produces its own lubrication, definitively bust this myth of, lube dependency, and then reveal the hidden chemical dangers sitting on drugstore shelves that actually can destroy your cellular ecosystem.
Okay, so before we even get to the scary products in the drugstore, I feel like we have to understand the incredible complex machinery behind how the body's natural regulation actually works in the first place.
Yeah, the biology of wetness is so misunderstood.
Right, because I think a lot of people, myself included before reading the sources, just assume it functions kind of like sweat.
Oh, absolutely.
Like you get warm or, in this case, aroused, and moisture just sort of, seeps out of a local gland.
Yeah, that is a super common misconception. But the reality is it's this highly dynamic, multi-step physiological process that is heavily, heavily driven by blood flow.
Okay, wait, hold on. Blood flow.
Yeah.
Because, how does blood flow equal lubrication? Like, blood isn't what's hydrating the tissue, obviously.
Right. It's not the red blood cells themselves, but the blood is what powers the entire process. You can actually think of it as being mechanically very similar to a penile erection.
Oh, wow. Okay.
Yeah, the vaginal walls are incredibly rich in blood vessels. It's this massive capillary network just, waiting to be activated. So when sexual arousal occurs...
Okay, that's physical or mental, right?
Exactly. Whether it's physical touch, mental stimulation, or whatever combination of both, the brain sends these rapid signals down the nervous system to the pelvic region. And those signals basically instruct the blood vessels in the genital area to rapidly dilate.
They just open up.
Right. They literally widen to accommodate this massive sudden surge in blood volume.
Okay, so the tissue is like swelling with blood. I get that part. But how does that turn into a liquid on the actual surface of the skin?
Okay, so this is where the physics of the human body just gets totally fascinating. Because of that intense rush of blood, the internal pressure inside those tiny, tiny capillaries spikes dramatically.
Just from the volume.
Yeah, and that pressure becomes so great that it actually forces plasma, which is the clear liquid portion of your blood. It forces it to physically filter right through the vaginal walls. It's true. It pushes right through the layers of epithelial tissue in a biological process called transudation.
Wait, transudation? So it is literally filtering the plasma out of your blood to use as moisture.
Exactly.
That is just incredible.
And, it doesn't even stop there. Once that filtered plasma reaches the surface, it combines with mucus produced by the cervix and also secretions from localized glands, like the Bartholin glands near the opening.
Right, so it's a whole cocktail.
Yeah, all of those elements mix together to create this completely natural, highly specialized, pH-balanced lubricant.
Okay, so hearing the actual mechanics of it, it makes the whole system sound I don't know, so much more fragile than just sweat glands turning on.
It really is.
Like, it sounds like this delicate chain of events where if you break one link, you could just halt the whole thing.
And many factors can and absolutely do disrupt it. I mean, the entire plasma filtration process is heavily reliant on estrogen, for example.
Right, the hormone piece.
Yeah, estrogen maintains the thickness, the health, and importantly, the elasticity of that vaginal wall. So if estrogen levels drop, which, happens naturally during menopause or in the postpartum period, or while a mother's breastfeeding, that tissue thins out significantly.
No, the blood vessels shrink too.
Exactly. The blood vessels shrink, and that whole transudation process just slows down to an absolute crawl.
Makes sense.
And it's not just hormones. Common medications like antihistamines, if you take an allergy pill to dry out the mucosal lining in your sinuses, it doesn't just target your nose.
Oh, wow. It dries out everywhere.
It simultaneously dries out your vaginal mucosa. Plus things like stress, diabetes, thyroid disorders, all of these can interrupt that super delicate vascular response.
Okay, so let's bring this back to our core mission today and, that lip balm analogy we talked about.
Right.
Because it is this widely held belief that if you use artificial moisturizers too much, your body senses that external moisture and just kind of stops making its own.
Which is exactly what people worry about with lube.
Yes. So if a patient is using artificial lube daily to combat, say, that menopausal dryness you just mentioned, does the body sense that commercial lube decide, oh, the area is adequately hydrated, and just shut off the plasma filtration? Like, do we risk creating a biological dependency where the tissue genuinely gets lazy?
Based on all the medical literature in our sources, the answer is an absolute definitive no.
Really? No biological dependency at all?
None. Concerns about physical dependency or, permanently altering your natural mucosal self-regulation just by using a synthetic lubricant are entirely unfounded.
So there's no, negative feedback loop?
Exactly. The human body simply does not possess a biological sensor on the surface of the vaginal canal that detects synthetic lubricant and sends a message to the brain to turn off the blood flow.
It just doesn't exist.
Right. The vascular response to arousal operates completely independently of whatever fluid happens to be sitting on the surface of the skin at that moment. So, using lube does not cause addiction, it does not cause biological reliance, and it definitely does not make your mucosal lining lazy.
Okay, so the big takeaway for you listening is that using lubricant is really just a healthy, practical tool. Like, it's not a crutch. Your body is not going to suddenly forget how to lubricate itself just because you gave it some synthetic help.
Precisely. You are simply providing slip where the body's mechanics are, currently struggling to produce it.
Well, that's a relief. But, and this is a big but, while physical dependency is a myth, our sources point out that psychological dependency is a very real and honestly very complex issue.
Oh, absolutely. This is where the research gets really deep.
Yeah, because the medical literature highlights this phenomenon where lube is used not just for physical friction, but to actively mask deeper emotional or physical disconnects.
Right. And to really understand the psychological layer, we have to look closely at this fascinating study from Taylor and Francis. The researchers focus on what they term sexual safety behaviors, or SSBs.
Okay, SSBs. Because in psychology, generally, safety behaviors are usually things people do to manage, like severe anxiety, right?
Yeah, exactly.
Like, I'm thinking of someone with social anxiety who obsessively checks their phone at a party just to avoid talking to people. So how does that concept translate into intimacy?
Well, the underlying mechanism is actually surprisingly similar. The study found that women often employ these psychological or behavioral strategies to minimize what they perceive as negative outcomes during intimacy.
Like what kind of strategies?
It could manifest as avoiding certain sexual practices altogether, or maybe engaging in really intense, almost obsessive personal hygiene rituals before sex, or, and this is the crucial one for our discussion, faking sexual arousal.
Faking it. Okay.
Yeah, they do this to avoid disappointing a partner, maybe to avoid an uncomfortable conversation, or honestly, simply to get an unwanted sexual encounter over with as quickly as possible.
Wow. A quote from our sources really stuck with me on this exact point. It noted, and I'm quoting here, "You can feel desire without lubrication, and you can have lubrication without desire."
That is such an important distinction.
Because physical arousal and subjective emotional desire are controlled by two overlapping but often completely separate systems in the body.
Yeah, researchers actually call that non-concordance.
And the concordance, right.
It means your brain can be entirely disinterested or even completely averse to what is happening, but your physical body might still produce a physiological response.
Which can be really confusing for people.
Incredibly confusing. And it works vice versa, too. You might desperately want to be intimate with your partner, but due to, say, stress or those hormone drops we talked about, your body just isn't physically responding.
Well, wait, let me play devil's advocate here.
Yeah.
Isn't it completely normal to, like, just want to get it over with sometimes? Or, I don't know, to use a little lube because you don't want to hurt your partner's feelings. Why does the medical literature classify reaching for the lube as a dysfunctional safety behavior?
Yeah.
Like, where is the line?
That's a great question.
Yeah.
And the researchers draw a very sharp line based on intent and, crucially, the pattern of use.
Okay, the pattern.
Right. So, using lube to cope with natural physiological dryness. Let's say you're taking an antidepressant that causes dryness, or you are postmenopausal, but you genuinely desire intimacy. That is a highly functional coping mechanism.
Because you actually want to engage.
Exactly. You want to engage, and your body just needs physical assistance to match your mental state.
The tool is just helping you achieve a shared goal.
But the behavior becomes maladaptive or dysfunctional when a person uses it repeatedly to simulate an arousal that genuinely does not exist. If someone is consistently using synthetic lubricant to bypass their body's lack of readiness, right, to endure sex they don't actually want, or to avoid communicating a boundary to their partner, then the lubricant ceases to be a helpful tool. It becomes a psychological crutch used literally to silence the body.
So the danger isn't being addicted to the lube itself.
No.
The danger is relying on the lube to override your own physical boundaries. Like, it allows you to just avoid addressing a fundamental disconnect in the relationship or in your own feelings of emotional safety.
Exactly. And over time, chronically overriding those physical boundaries takes a severe psychological toll. You know, the body is using dryness as a signal. It's a physical no or a not yet.
Right.
When you consistently use a synthetic product to turn that no into a mechanical yes, you create this profound damaging disconnect between your mind and your body. And that is the true dependency the sources warn about.
Man, that is a heavy, incredibly important distinction. The psychological threat is real. But earlier you mentioned there is also a severe physical threat hiding right on drugstore shelves.
Yeah, we have to talk about that.
Because if we just establish that lube doesn't harm the body by making the tissue lazy, how is it actively destroying the cellular ecosystem, like I mentioned in the intro?
Well, the threat comes down to the actual chemistry of the products people are buying,
Right.
specifically a scientific concept called osmolality.
Okay, osmolality. Let's break that down for everyone listening. What exactly are we measuring here?
So osmolality is a measurement of the concentration of dissolved particles in a fluid.
Like what kind of particles?
We're talking about things like sugars, salts, proteins, various chemical compounds. And your natural vaginal secretions are perfectly calibrated by the body to maintain balance with the cells of the vaginal wall.
Okay.
That natural fluid has an osmolality of about 260 to 290 milliosmoles per kilogram.
260 to 290. So that is the baseline our bodies are happy with.
Exactly. And because of that baseline, the World Health Organization strongly recommends that any personal lubricant you use should stay below 1,200 milliosmoles per kilogram.
Okay, so under 1,200.
And ideally, it should be much, much closer to that natural 290 level. But the problem we face as consumers is that the studies show most over-the-counter commercial lubricants are massively hyperosmolar.
Meaning they're way too concentrated.
Right. The data shows popular products, the ones you see everywhere, testing at over 5,000 milliosmoles per kilogram.
Wait, 5,000?
Yeah, over 5,000.
If the natural fluid is around 290, 5,000 is staggeringly high. So what physically happens when you put a fluid concentrated at 5,000 right next to delicate tissue cells that are calibrated for 290? Like, what does that do?
Well, nature always wants to find a balance, right, through osmosis. So when you introduce this massively concentrated fluid to the surface of the vaginal wall, the lube is essentially starving for water to dilute itself.
Oh, no. So it pulls the water from the body?
Yes. It forcefully pulls water directly out of the surrounding cells.
It just rips the hydration right out of the tissue.
Yeah.
It's like putting salt on a slug or dropping a freshwater fish into the ocean.
That is a perfect analogy, actually, and the medical data observing this exact mechanism is terrifying. Our sources detail these in vitro studies conducted on specific vaginal and colorectal epithelial cells, which are known as CACO2 and HEC1A cells.
Okay, so they tested this in a lab on these specific cells.
Yes. And when researchers exposed these cells to those hyperosmolar, highly concentrated drugstore lubes, they literally watched the cells rapidly dehydrate. They just shrivel up.
Just from making contact with the lubricant.
Just from contact. Within just 30 minutes of application, the researchers observed significant barrier loss in the mucosal monolayer.
Wow. 30 minutes.
Because the cells are losing all their water, they lose their structural integrity and basically collapse. This leads to what the medical community calls epithelial stripping.
Epithelial stripping. That sounds painful.
It is. The top protective layer of tissue is literally pulled away, which causes severe microabrasions and massive inflammation.
So if that top barrier is stripped away,
Hmm.
I mean, your body's primary physical defense against the outside world is just gone.
Which brings us to the absolute most dangerous consequence of all this. That cellular damage drastically increases your susceptibility to transmitting sexually transmitted infections.
Oh, wow. Because the barrier is broken.
Exactly. The studies highlight that these hyperosmolar lubricants can greatly enhance the transmission of pathogens, particularly HIV. The virus no longer has to fight its way through a healthy mucosal barrier. It has a direct, open pathway through that damaged, inflamed tissue right into your bloodstream.
That is horrifying.
Yeah.
So the takeaway for you listening is that just grabbing whatever bottle is cheapest or, has the prettiest packaging at the pharmacy is a massive gamble. You literally have to turn the bottle over and read the labels or look up the brand data online before you buy it.
You really do.
You need to look for isoosmolar lubricants, right?
Yes. Isoosmolar.
Because those are products calibrated to match your body's natural fluid concentration. Isoosmolar lubes protect your cellular integrity, while hyperosmolar lubes will actively destroy your tissue in, the time it takes to watch a sitcom.
Right, 30 minutes. And unfortunately, the destruction caused by poorly formulated products does not stop at the human cells.
It gets worse.
It does. Damaging the vaginal walls is bad enough, but these highly concentrated and often highly alkaline lubricants also wage a microscopic war on the vagina's microbial defenders.
Okay, the microbiome. We hear so much about the gut microbiome these days, but the vaginal microbiome is its own complex, self-cleaning ecosystem, right?
It is an incredibly complex ecosystem. And in a healthy reproductive age woman, that ecosystem is primarily guarded by these beneficial bacteria called lactobacilli.
Lactobacilli.
Right. These bacteria are essentially the gatekeepers, and they thrive in a highly acidic environment, specifically maintaining a pH between 3.8 and 4.5.
Why is the acidity so important to them? Why not neutral?
It is their primary weapon against invaders. The lactobacilli actively produce lactic acid themselves to maintain that harsh acidic environment.
Oh, so they make the acid.
Exactly. And most harmful pathogens simply cannot survive in a space that acidic. So the lactobacilli essentially create this hostile fortress that keeps infections at bay.
But okay, a quick look at commercial lubricants shows that a lot of them are not acidic at all. Some of them have a neutral pH or even an alkaline pH of 7 or 8.
Very common.
So if a patient is using a highly alkaline lube, how does the ecosystem react to that?
It basically crashes. When you introduce an alkaline lubricant, you instantly spike the vaginal pH. And the protective lactobacilli physically cannot survive that pH shift. They die off rapidly.
Wow.
And when they die, the production of lactic acid stops completely.
But the fortress walls just come down.
The gates are wide open. Opportunistic pathogens that were previously being completely suppressed by the acid suddenly have this perfect, welcoming environment to multiply out of control.
And what does that lead to?
This precise mechanism is exactly how patients develop severe overgrowths of Gardnerella.
Which causes bacterial vaginosis, right?
Exactly, bacterial vaginosis. Or they find themselves battling these recurrent, incredibly stubborn yeast infections, all because the pH was thrown off.
Okay, so we have hyperosmolar lubes shriveling the human cells and alkaline lubes massacring the good bacteria. I mean, it makes introducing anything synthetic sound like walking into a minefield. Is there any good news in the literature for people who actually need to use these products?
There is, actually. There's incredibly reassuring news. A recent randomized controlled trial published in the journal MDPI looked at this exact issue in actual human bodies over time.
Oh, fantastic. What did they do?
They tracked 50 women across 3 different age groups, including postmenopausal women, and the participants were instructed to use water-based lubricants that strictly adhered to the WHO guidelines we talked about.
Okay, so the products were isoosmolar and properly pH balanced to match the natural vaginal environment?
Exactly. Good, healthy chemistry.
And what did the swabs show after they used them?
After 4 weeks of consistent, regular use, the researchers found absolutely no significant alteration to the women's vaginal bacterium.
None at all.
None. The lactobacilli populations remained robust and totally stable, and the acidic pH was perfectly maintained.
Oh, that is a massive relief. So the takeaway is that the right chemistry safely integrates into your biology. An isoosmolar, pH-balanced product gives you the friction relief you need without disrupting your acid mantle or killing your defenders. So you do not have to avoid lubricant. You just have to demand better products.
Yes. It just requires a shift in how we, view these products. They are not just slippery liquids. They are medical devices interacting with a highly sensitive ecosystem.
Okay, let's shift to a very practical application of all this science. Because if someone is dealing with continuous daily dryness, say they're going through menopause, their estrogen is dropped, and that natural plasma filtration process is just slowed down, how do they manage that discomfort every single day?
Right, the chronic dryness.
Yeah, because it is a well-formulated lubricant actually the right tool for round-the-clock application.
This is an area where patients and frankly even some medical professionals get the protocol wrong.
Really?
Yeah, there is a strict functional difference in the medical literature between a vaginal lubricant and a vaginal moisturizer.
Okay, wait. Let me see if I can synthesize this based on everything we've covered today.
Go for it.
A lubricant, even a perfectly formulated one, sounds like a raincoat. It's a superficial layer that you put on for a specific event, like sexual activity, just to reduce immediate friction. It does not actually absorb into the skin to hydrate it.
That is the perfect analogy, yes. Lubricants, whether they are water, silicone, or oil-based, they are strictly formulated for immediate, short-term relief during intimacy.
Right, they just sit there.
They sit on the surface of the tissue to provide temporary slip. And actually, as a quick safety note, since we mentioned oil-based lubes, it is critical to remember that oil rapidly degrades latex, so never, ever use an oil-based product with a latex condom.
Good to know. Okay, so the raincoat is for the event. So how does a moisturizer function differently on a chemical level?
So vaginal moisturizers are engineered to be what we call bioadhesive.
Bioadhesive, meaning they stick.
Exactly. They are formulated with specific binding polymers, like polycarbaphyl is a common one. When you apply a moisturizer, these polymers physically attach themselves to the mucin and the epithelial cells lining the vaginal wall.
Oh, interesting.
Yeah, instead of just sitting on top for a temporary slip, they grab onto the tissue and they actively retain water at the cellular level over a period of several days.
So they are actually changing the hydration content of the tissue itself over time.
Precisely. They rehydrate the epithelium long term. A patient typically applies a bioadhesive moisturizer, every 2 to 3 days, completely independent of whether they are having sexual activity.
So it's like a daily face cream, basically.
Exactly. They are designed for regular chronic maintenance. They help lower the pH back to healthy levels, and they bring vital water to the tissue without altering the actual cellular maturation, which is what a prescription hormone cream would do.
Right, it's non-hormonal.
Right.
So if you are dealing with chronic daily dryness, the kind that makes it agonizing just to walk around in jeans or sit at your desk for 8 hours, a bioadhesive moisturizer is your primary long-term medical tool. And the lubricant is your short-term friction fighter, specifically for intimacy.
You have to use the right tool for the right job. You wouldn't wear a raincoat to cure systemic dehydration, right? You have to treat the underlying tissue health first.
Wow. We have covered some truly groundbreaking territory today. Let's pull all of these threads together for everyone.
Sounds good.
We started with that lingering anxiety about the body getting lazy, and we can definitively say the myth of biological dependency is busted. Your body will not forget how to produce its own moisture just because you use synthetic products.
Right. You do not need to fear creating a lazy mucosal lining.
But the absence of physical dependency does not mean the absence of physical danger. You must protect your cellular ecosystem by reading the labels.
The real threat is cellular destruction from hyperosmolar, highly alkaline drugstore products that literally strip your tissues and kill your microbiome.
So you have to seek out isoosmolar, pH-balanced products. And you have to know the difference between a daily bioadhesive moisturizer for chronic dryness and a short-term lubricant for intimacy.
Exactly. When you equip yourself with the right chemistry, you are working in perfect harmony with your body's natural machinery, rather than accidentally waging war against it.
Which brings us to a final profound concept from our sources that I really want to leave you, the listener, with today.
Yeah, this part is so important.
We explored the psychology of using lube as a sexual safety behavior, right? faking
Ugh.
arousal to minimize negative outcomes. Well, the medical literature explicitly notes that sexual trauma, whether it's recent or deep in the past, can strongly affect arousal and natural lubrication, even if that trauma feels intellectually resolved in your mind.
Because the nervous system's primary directive, above all else, is survival and safety.
Mm.
If your subconscious senses lack of emotional safety or even just detects a subtle risk based on a past experience, it will automatically step in. It restricts blood flow to the pelvic region and literally shuts down that plasma filtration process to protect you.
And that physical response is completely unconscious. It is not a personal failure, and it doesn't necessarily mean a lack of love or desire for your partner. It is your body throwing up a brilliant protective boundary.
Exactly.
So here's something to ponder as we wrap up this deep dive. If our bodies use dryness as a physical signal, like an alarm bell, that we are not emotionally comfortable, fully present, or safe in a given moment, what happens to our psyche when we consistently silence that alarm bell with synthetic lubricants?
It really challenges us to completely reframe how we interpret our physical responses. Are we viewing dryness as a mechanical failure that just needs to be fixed, or as a vital piece of communication to be listened to?
Exactly. Because if you are constantly applying the lip balm to force a physical reaction, you might be bypassing the most important conversation your body is desperately trying to have with you. Treat your body as an ecosystem to be respected, not just a machine to be hacked. Thanks for taking this deep dive with us. We'll see you next time.